Hey guys, it's your girl Jay. Welcome back to my channel. Don't forget to like, share, subscribe, and click the bell notification for updates about my nursing journey. So today I wanted to talk about what quarter 4 is going to look like for me. Currently, I am in quarter 4. I have 3 main classes and 1 got added because we weren't allowed to do clinical last quarter. So I know I'm missing my quarter 3 video for you guys, but I have to get that one put together because there's a bunch of little bits of it, and I wanted to make a nice video for you guys who are following me. So yes, let's get back to quarter 4 and the classes. So the classes consist of Med-Surg 5. We have a couple chapters we still have to finish in our book, and then we also have Issues and Trends, and then we have Clinical, and we have another clinical course that we're going to be taking because we weren't able to do it last quarter. So it's going to be Clinical 151 and Clinical 161, if I'm not mistaken. We have those 2 clinical classes. And yes guys, so today is September 29th. Today we started doing our clinicals, and we went to our first facility, which we're gonna be here for a couple weeks, but today was just orientation. So for orientation, we had to go in at 12:45. They started the checking us to see if we had fevers, asking us questions, and making sure we had masks, we had our proper attire and stuff like that. And then once they screened everyone, then we had to go inside, and we went to a small a small room, and they started to talk to us what they expected from us, what we had to do. We have to be professional, wear proper attire. They gave us the N95 mask, or like the surgical kind of mask like these, and they also gave us a face shield, as you see here. We're gonna have these face shields and these types of masks. We cannot wear cloth masks, so I came prepared with my cloth mask, and they said we're not allowed to wear those, so we all had to take ours off and get one of those. Some of us came prepared with the N95, but I mean, we didn't know, so I came with one of these types, the cloth ones, and they gave us a different version of them. And yeah guys, so after that, they started to talk about PPE. We know that we have to wear our proper personal protective equipment. It is crucial at this time in the healthcare industry because of the coronavirus, because how deadly this virus is. We have to take it serious, and we have to follow our protocol and all those nitty-gritty details. So after they talked to us about it, we had to get checked off on our PPE, and also we had to get checked off on our gowning and donning. So, putting it on and taking it off. And we also had to do a coronavirus nasal pharyngeal swab, which we were able to do on ourselves. I did a little video about that of one of the girls doing it on each other. I'm just gonna ask them for permission before I upload it. And basically they told us to measure with the swab from our ear to our nose and go halfway, and if you meet resistance, then you're gonna stop. You're not gonna push, because you can either protrude and cause some kind of lesion or something. So when you meet resistance, you're gonna stop and hold for 10 seconds, and you can twist it and turn it and stuff like that, but no longer than that. Then we would put it in the tube and make sure it's labeled with your last name, first name, date of birth, and label it NP for nasal pharyngeal. And sorry if I'm mispronouncing that or something, but I'm trying to make this video for you guys now when it's nice and fresh in my head. So yeah, so after that guys, we did the swab, and then we did our checklist. We had to sign for that, of course, getting consent that we're allowing them to check for COVID-19. Of course, if you refuse, then you're not going to be in clinical, and that's what we all want. We want to be able to finish our hours so we can graduate in December. So yeah, guys, so after we did all those stuff, we ended up going to we did a tour. So we did a tour of the building, and it was really nice because they showed us how the state had labeled certain units a yellow unit because it's like precaution measures, then the green unit because it's more of a like go unit, like there's no COVID patients, and even if there wasn't any COVID patients on the yellow unit, but it was still labeled for a precaution unit, then we know that the red units were the coronavirus units. So yes, so we know this is expected. As a nursing student, we know this is going to be expected, and honestly, if you didn't want to deal with coronavirus or any type of virus, then maybe nursing isn't for you. But based on my experiences in the healthcare field, there's going to be viruses, there's going to be the deadly ones, there's going to be a whole bunch of things you're going to encounter. But if this is for you, then you know where your heart's at, and you know that you're doing it for a reason, because you want to take care of the sick patients, you want to take care of the deadly, you want to do this for a purpose, and the purpose is to help those in need, and hopefully they get better, and if not, just be there for the family and whatnot. So that being said, guys, I try to take you with me on this journey. It's going to be kind of hard because, as you see, we're going to be gowning and donning, and it's not going to be easy, and plus HIPAA and HIPAA, the Health Insurance Portability Act, Health Portable, you guys know what HIPAA means. I don't remember at this point, but I know it's Health Insurance Portability Private Act. Yes, there you go. So that being said, I have to be precautious, and I cannot be videoing anything in there because I can get in trouble. So if we practice stuff, like they said that they allowed us to practice doing the COVID testing on each other. So we got a partner and we did it on each other. They said that they're going to allow us to possibly get the flu vaccine, and we can practice also on each other. So if we do that, then I'll definitely record that as well, and then show you guys how that goes. But besides that, guys, I want you guys to remember that this journey is gonna be hard. And look at me. Remember my first video in first quarter? I was a mess, and I was so insecure, and throughout the time I became more secure of myself, and I know that I haven't been trying to achieve this goal to become a LPN, RN, and whatnot for no reason. Like, I know where my heart's at, and I know that this is what I want to do. So that being said, I want you guys to keep on persisting. I want you guys not to give up, and I want you guys to pick yourself up if you fall, because at the end of the day, nobody is perfect. And remember that even if there's someone who claims to be perfect and they think that they're not gonna make any mistakes, who cares? Because in your clinical sites, you're gonna meet people that are just like they say, they throw you to the wolves, or they eat the young. And it might be true, it might not be true. You might have a good experience, a bad experience, but at the end of the day, guys, this is going to be your experience, so make the best of it. If someone like a mentor or the person who is instructing you isn't teaching you the right way, or is giving you a hard time, speak to your instructor, tell them what's going on, and then just find the problem and then your resolution. Do not stay quiet, because you're going to have a miserable clinical and you're not going to learn. You're going to just be worried that you don't want to go to clinical because they're not treating you right. So I definitely have learned to express myself and have a voice, because everyone has a voice. We just have to use it, and especially when you have those kind of situations. So yeah, guys, so I hope you guys like my video. Don't forget to like, share, subscribe, hit that notification bell, and I hope this video was helpful for you guys. I'm going to try to add a little bit more stuff to it, because I want you guys to see what I did with my schedule. I planned in advance. I see if I have it here. I probably don't, but I printed out the 4 months that technically 3 months I have left of nursing school, because we're supposed to graduate in December 16th-ish, and I printed out September, October, November, December. Yeah, so I printed out the next 4 months of my life and I started to plan. So planning is super, super good, guys. I know I said I was going to cut this video, but I want to explain to you guys about planning. So I printed out those monthly calendars. I wrote on them and I added all my clinicals from today and so forth. And then I also added my work schedule, and then I also added my personal life, like any appointments, any birthdays, any baby showers, any stuff like that, to that calendar. Then I transcribed it into my phone. And you know how you have your Apple Calendar, your Google Calendar, whatever type of calendar you have, just make sure it's an electronic one, because you're always on the run. So you can't be walking around with papers in your purses and flipping and all that good stuff. And you know your girl Jay loves electronics. So I added it to that, guys. And after I added it, it actually only took me about an hour, because I had to, do other stuff in between. But after I was done, I was so relieved, because I wake up in the morning, I see what's on my to-do list on my calendar, and it says go to clinical. And then I made sure to turn on my calendar on each event. I made sure to turn on my travel time. So I put the address, and then it says the travel time. And that honestly helped me a lot, because now I'm driving to clinical. I know an hour in advance that it's gonna be 30 to 40 minute drive, and I had to drive 30 minutes for this clinical. So I'm gonna be coming here for the next couple weeks, and I honestly have to plan in advance, because many of my classes seem a little complicated and I just want to be prepared. So I also wanted to tell you guys that cut off all distractions, guys, because I, for one, am a very big procrastinator, and I know that we let social media and social networking get to us. And of course we want to have a life, but we want to be successful. So in order to be successful, we need to set our priorities, and my priorities is to pass all my exams and pass my NCLEX. So that being said, I logged off of most of my social medias except like YouTube and TikTok, because I find very interesting stuff on TikTok. But my purpose is to use it as a treat. When I do good for my exams, or when I have downtime, I will use it. But if not, I'm going to try as much as possible to not use it, besides making videos for you guys, which are going to be very beneficial for you. So that's another way to fight your distractions. And I also downloaded a timer kind of thing on my phone, an app that's going to help me when I study, from increments of 15 minutes, take breaks, and then also hide my phone while I'm studying, like in my cabinet or something, and make sure to study for your NCLEX, guys. I know a lot of people have different studying strategies, and everyone's different, to be honest. And personally, myself, I have found that I need to study in advance. I need to be structured, and I need to be persistent. So starting yesterday, I started to study, and I know there's stuff about UWorld. I know there's stuff about the NCLEX review. I think it's like a review book or something. Oh, Saunders. Yeah, the NCLEX review book, Saunders. And also there's another one called Archer Review. Just find, oh, and Quizlet, guys. Quizlet's really good too. Just find a review page, app, book, whatever works best for you, your notes, and just review and do at least 60 to 75 questions a day of all the different topics, because you know that your NCLEX test will have various topics, will have various types of answering formats, and you want to be prepared. So I started yesterday planning and preparing. Today I woke up at 8 in the morning. It's already 3:13 p.m. I woke up around 6 to 8ish, but I laid in my bed while my son was sleeping. I put my first exam for 2 hours, and I had 75 questions. So I got a 50 the first time because it's my first test, and next week on Tuesday we're gonna go to school in person because we've been doing everything online, and we're gonna take a Kaplan readiness exam. So that's gonna basically see how we're doing, and if we're gonna pass the NCLEX and what our grade is gonna be. And basically, if we don't pass with a 67 or better, she said, we have to do remediation of the 100 questions, which I don't want to do that. So I want to at least score a 67 so I don't have to do remediation. And because I know that I need to study and I know I need to do good so I'm not, failing anything, I took the time to remove all my distractions and focus on what is present and planning in advance. So yeah, guys, so that is the way I am studying. I will try to add a video for you guys on how I prepared everything, and now how I have my tablet set up, and what I do with my calendar and stuff like that. I'll try to set a video for you guys about that. But basically, I hope I hit all the areas, and I hope this video is beneficial for you guys, and I won't try to prolong it anymore, but just to tell you guys to be prepared. Love you guys. Don't forget to like, share, subscribe for the 30th millionth time and follow me on my journey. Peace out.